Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, I'm talking about the field of mental health with Dr. Holly Vanderhoff. She's a clinical psychologist and associate professor of psychiatry and behavioral sciences at Upstate, and also the chair of the Public Education Committee for the Central New York Psychological Association. Welcome back to The Informed Patient, Dr. Vanderhoff.
For having me back.
Let's first talk about the significant shortage of mental health professionals in the United States. Why don't we have enough providers?
I think there are many potential answers to that question, but certainly we know that there are shortages for mental health providers. And there's some projections saying that we'll be in a very drastic, nearly catastrophic shortage by about 2037, especially in the areas of child and adolescent mental health and substance abuse treatment. So we know that there are real impacts that have already occurred because the shortage is likely to get worse. There's some thought that perhaps there are too few people going into the profession for several reasons, but we also know that the rates of some major mental health difficulties appear to be rising. And we haven't seen a parallel increase in the numbers of providers available. And especially, I think, as people become more aware of mental health as something that's important, as there's less stigma around it, as people are maybe identifying sooner in their own lives that they may need some help, you may see more people seeking help who maybe otherwise would not have. And again, without that increase in providers, we start to experience a shortage of those. But I think another major factor to keep in mind is that those shortages aren't distributed evenly, right, across the country. So if you are looking at a county or an area that's very rural or remote, the providers are very few and far between compared to a more urban area where there may still well be a shortage, but the providers are much more plentiful.
Why aren't we seeing an influx of younger people into the profession if there is an obvious increase in need? Why aren't people attracted to this profession?
I think many people would really feel and do feel attracted to a profession where they can make a real difference and really help other people. I don't know that it's a lack of interest in doing that, but to become a professional in this field, to become licensed as a mental health professional of any kind, is years and years of training. So there's got to be a very high willingness and ability to invest that kind of money in your degree. So even if you're getting a master's degree to become licensed, that's a 2 to 3 year commitment beyond to your undergraduate work. And if we're talking about a doctoral degree, one of the professions that requires a doctoral degree, we're talking 4 to 6 years, plus additional years of supervised practice beyond that. So overall, it can be a really long-term, expensive prospect to go into this field. The other thing that might happen, especially if someone wants to work, say, in private practice and do private therapy or management, if you happen to be a psychiatrist or an MD, is you typically will make less than other types of healthcare providers might make. In our country, insurance reimbursement is still relatively poor for mental health care compared to other kinds of healthcare specialties. I think one other thing that might keep people from going into this profession is that many of those programs that I was just talking about, they're really highly competitive. So for instance, to become a licensed psychologist, you need to complete doctoral degrees in clinical psychology, especially the PhD version. Statistically are more competitive. They have a lower acceptance rate in medical studies. And so I think even folks who are very interested potentially in doing this work can feel that there are real barriers to getting where they would need to be able to do this in a way that where they can support themselves and make a career out of it.
So there seem to be a lot of different roles in the field of mental health, a wide variety of professionals. So I'd like to have you explain the differences and talk about, well, some of the training and then some of what these therapists are able to do. Even the word therapist, is that interchangeable with counselor?
Certainly, commonly people will use both words. And when they're talking about mental health, they're generally referring to being in counseling, being in therapy. But the words generally are not interchangeable. So really broadly, a counselor is a term that would refer to someone who advises others. And that could be anything from, yes, a mental health counselor to an admissions counselor, a financial aid counselor, even the word counselor gets applied to attorneys. A therapist is usually someone who provides a therapeutic intervention of some kind. So this could again include mental health therapists, but physical therapists, speech therapists, all kinds of therapists. So in the world of mental health, if people are saying, I'm seeing a therapist or I'm seeing a counselor, that feels interchangeable, but it doesn't really tell you much about that professional's education. Within the field, I would think of therapy as including a range of long and short-term mental health interventions or treatment options. Well, counseling, we usually use it to refer to very short-term kind of problem-focused interventions. And so, for instance, if you come in and I'm a counselor and you just had a difficult breakup, we might be working in a short-term way on solving some problems that you're facing around that breakup, coping with your feelings, arranging for new housing, whatever it might be. If I'm working with this issue from a deeper therapeutic point, yes, we might do all of that, but we also might get more into your history of relationships, what you saw growing up in relationships, what this breakup means to you, more of an existential way. So we would tend to go deeper in therapy than standard counseling.
What's the difference between a psychiatrist and a psychologist?
Oh, this is a great question. And it's so easy to get these terms confused. A psychiatrist is a medical doctor, is a physician. And so they earn usually an MD, but possibly a DO in medicine. And then they go on to spend several years completing specialized training in psychiatry. Psychiatrists typically, not all of them, I'm painting with a broad brush here, but typically psychiatrists view mental health problems as built on more of the medical model, right? The disease model of what's happening. And so they focus more on providing biologically based interventions to help people who are struggling with severe persistent mental health disorders, although many of them do get trained in providing psychotherapy and do enjoy that work. A psychologist, on the other hand, is usually a licensed psychologist, has a doctoral degree in clinical psychology. That could be a degree, either a PhD or the PsyD, which stands for Doctor of Psychology. And this requires, as I said earlier, many years of training and then time spent after graduation in supervised practice before the person can practice independently. Clinical psychologists compared to psychiatrists, they tend to view mental health problems as potentially painting with a broad brush in a more holistic way, right? Coming not only maybe from the individual's biological vulnerabilities or tendencies, but also to situational, environmental factors. Clinical psychologists tend to focus on assessing and then treating mental health issues through psychotherapy.
So there are a lot of people who get an undergraduate degree in psychology, but when they graduate, they're still quite a ways from becoming a psychologist, right?
That's right. It won't get you too far down the path. It's absolutely important to do that work. But the thing with an undergrad degree is what's great about it is you just get to survey and learn so much about all the different aspects of the field of psychology. Clinical psychology and counseling psychology, that's only one part of psychology as a field. So when you come out with your undergrad, maybe you've taken a few courses in that area and you've had a taste of it, but you're not yet prepared to go on and do the kinds of work that a professional licensed psychologist would do. So from that point forward, you'd need again to complete a formal doctoral degree that could take 4 to 6 years to do. And as part of that, you'd also complete a full-time year-long residency or internship toward the end of the degree program. And then after that, another full year of supervised practice, you have your doctorate.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with clinical psychologist Holly Vanderhoff from Upstate's Department of Psychiatry and Behavioral Sciences, and we're talking about the mental health profession. I've heard of nurse practitioners and physician assistants who specialize in psychiatric care. So what does their education consist of?
They're really important members of the mental health professional spectrum here. So nurse practitioners, my understanding, right? I'm not an expert in this area, but that nurse practitioners first get a bachelor's degree in nursing or become an RN, and then earn a master's or sometimes now even a doctoral degree in nursing. plus having many years of supervised practice, typically supervised by a physician, and sit for specialized exams so that they can specialize in psychiatry as the focus of their practice. Whereas physician assistants earn a bachelor's degree and then do a 2-year master's program, plus another year or two in specialized training in psychiatry. They also have to sit for exams. Typically, PAs compared to NPs are a little more focused on that medical model, and they tend to approach mental health issues much in the same way as psychiatrists might approach them. Whereas NPs seem to come from a more holistic model of training, and they focus, I think they would describe themselves as very patient-centered and collaborative with their patients rather than necessarily viewing it's a purely medical issue.
Now, where do licensed clinical social workers fit in?
They're also incredibly important to this field. They are more plentiful than psychologists or psychiatrists, thankfully. Like psychologists, a licensed clinical social worker can diagnose and treat mental health disorders with therapy. They can also provide things like case management or advocacy support, not only to the individual, but to the systems, the groups around that, like their family or others in the community. The licensed clinical social worker has taken a master's degree in social work, and then post their master's, they need to do, at least in New York State, 3 years of supervised practice to earn their license to be able to practice independently. So it's a long commitment.
What about marriage and family therapists?
And here's another version of a mental health provider who do sometimes see individual clients, but just like the name suggests, they mostly focus on working with couples or with families. These folks have either a master's or a doctoral degree, and they can also assess and diagnose mental health disorders.
And many schools have the school counselor. Are some of the school counselors trained in therapy? And how would you tell, or how would you know?
Most people who are employed as school counselors typically now would hold a master's degree in school counseling. And that prepares them to do a whole range of things. So although they are not trained to do more ongoing psychotherapy or mental health treatment per se, they are trained in helping students, usually in the K through 12 setting, to set goals and work on academic achievement goals. They help students develop academic strategies and do a lot of their academic planning. But they are trained in doing very short-term counseling and certainly in crisis intervention to support students who may have mental health challenges within the school setting. So even though they are not ongoing long-term therapists or psychologists or other versions of a health professional, they have an important role to play. They're often, I think, one of the first folks in a school who might really understand how much a student is struggling and give some assistance at the beginning.
Well, can we talk about some possible ways to make the mental health profession more of an option for people? I understand that it does seem like there's a lot of people who would be interested in doing this work, but there's a lot of hurdles. What could be done, do you think, that would make it more of an option for people?
And again, I think it's first helping people understand the difference that you can make as a mental health professional. I think, a lot of us are naturally inclined to want to help others, and we're not quite sure how to do that. This is an important career, I think, for folks to consider if that's how they feel they want to use their career time, right, is helping other people. But of course, we have to reduce some of the barriers to having that training. So first, I think just, yes, educating more about the kind of positions one could hold. If what your image is of a mental health professional, if that image is, I sit in my private practice office all day and I see 30 people a week for individual therapy, that's only one version of what this could look like. So I think the representation of mental health professionals and education about what we do becomes important because we're in so many different settings, hospitals, prisons, corporate environments, schools, as we were just talking about, big clinics and healthcare systems, all the way down to, there are mental health professionals who are sometimes embedded in primary care clinics or practices. So I think first getting the word out that there are many other things you can do, sit in your office and do private practice all the time, which for some people, they don't want to do that. I think we have to talk money, right? So advocating for health insurance to reimburse for this version of healthcare at similar rates as to other versions of healthcare is very important. People, I think, are getting included, especially in states where there are a lot of shortages, that providing some financial incentive can be really helpful to encouraging people to pursue this as a career. So I know New York State Governor Hochul announced, I think it was just this past spring, that the state will provide awards, I think up to $30,000 to individuals going into these fields and who are willing to commit to living and working in New York State for a few years after they finish their degrees, and especially for those who are committed to working with children and adolescents or in underserved areas. But of course, programs like this vary by state. Loan forgiveness programs certainly exist. Those could be expanded. My sense is we could do more to incentivize people and educate them about the kinds of financial incentives that are out there to do this work. I think another broader issue with the profession is, my ability to practice starts and stops within the state I'm licensed in, right? So I can go see someone an hour from here in Binghamton and practice. But if I drive south just another 15 minutes, I'm not able to practice in Pennsylvania, right? I'm not licensed there. So I think the professions could do more to standardize first just the privileges and scope of practice of different kinds of mental health providers, and also do more to help us retain those privileges across state lines. Because I have talked with young people who say, I really don't want to have to get licensed in 3 different states, and I don't know where I want to live, and I'm not sure what to do about that. There are some states that have reciprocity with each other, and something called PsyPact is developing. State to state, you might be able to hold your license and retain all of this. But that still hasn't reached critical mass yet. So again, I think this is something broader that the profession needs to look at to encourage more people to head into.
How is the use of telehealth impacting the profession?
This is huge. I have to tell you too, before the pandemic, I had so many reservations about telehealth, and I was encouraged many times to consider adding it to the service that I run for Upstate. And I always said, no, in person is just the way you have to go. You can't possibly get to know the person well enough. It's really important that it be in person. And then the pandemic happened, and I saw for myself just how useful and valuable telehealth will I ever feel that it's exactly the same as doing things in person? No. There certainly are some severe or persistent issues that require, I believe, more of an in-person engagement. But telehealth has started to address some of the shortages that we talked about earlier. So if I live in a county where there are only 3 available child therapists, and maybe not even that, and I have a son or daughter who wants to go into therapy, I don't have many options for that. As long as they're within New York State, maybe I can locate a provider who's down in the city or in one of the more urban areas who's willing to work with my child through telehealth. So telehealth has expanded the reach of the profession in really, really important ways. So even though the pandemic is largely over now, we've continued to provide telehealth through the clinic that I oversee, because it's been so helpful in addressing that accessibility gap.
Why do you personally like the field of mental health?
My feelings about it, the things I've liked about it have sometimes changed over the years. Like so many people, I got into this field because I really wanted to help people. I was fascinated by the variability and how human beings develop, how they get through their life difficulties, how those difficulties impact them over time. And I just knew somehow that is really what I wanted to do. But over time, something else I have come to love about it and really cherish is that it's really a privilege to sit with someone who's working through what might be the most difficult or painful material or period of lives, who's working to heal from past trauma or other kinds of tough experiences, and to just, you can't live for that person. You can't solve all their problems. You can't save them, but you can walk alongside them while they're on this part of their path. And that's been absolutely the best thing about the work that I do is the privilege of being the person who gets to be. I feel like it really lets me get to know people in a way I couldn't if I were an engineer or a corporate executive. No shade to those professions, but for what I want out of my career, it wouldn't have been possible, those kinds of fields. So I'm still in awe of it and still really appreciative part of the field, even 20 years later.
How would you advise someone who's interested in the field to choose a path that they'll be happy with?
First of all, it's important to just think about the fact that there's no one way to do this, right? There are many paths up the mountain of thinking about entering to this as a field. And so in my mind, the most important thing to do is not think about what degree do I or what school do I want to go to, but to start first with what would I want to accomplish with that degree? What kinds of people, what kinds of problems would I like to work with? What do I think I would be especially skilled at addressing? What am I interested in, right? And then think about in what setting. Maybe you're someone who wants to work in private practice. Maybe you're someone who really wants to work in a hospital setting or with a geriatric population. So to start narrowing down your vision of what you would accomplish and who you'd be working in that field. And then I would start to consider what is at least the minimal degree necessary, right? The shortest timeline between where I am now and working in the field, and not getting attached to the idea that I must go get my doctorate because I just really want to call myself doctor, or I should only go for a master's because maybe I'm not ready for a doctoral program. Don't get attached to the degree. Think about what you want to accomplish. And then I would talk to people who are working and doing as close to your dream as you can find. Shadow them. Talk to them about their experiences, how they got into the field. Look at the degrees that they hold, find some programs they went to, and then start to investigate those more closely.
Well, Dr. Vanderhoff, thank you so much for making time to tell us about this profession.
You're so welcome. I'm really glad I got a chance to talk about it. One of my favorite topics. So thank you for having me.
My guest has been Dr. Holly Vanderhoff. She's a clinical psychologist and associate professor of psychiatry and behavioral sciences at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.